Hello, this is Dr. David Greene, CEO of the Nevada Pain Network, where we bring you anything and everything educational for pain management. Today the topic is an overview of sacroiliac joint pain. The SI joints, as they are also called, are where the pelvis meets up with the sacrum. So this is the iliac wing of the pelvis, and this area here is the sacroiliac joint. And as you can see, there are two of them. Now, they do contain cartilage, just like other movement joints in the body, but they have a lot less movement, only 2 to 4 millimeters during physical activity. They can degenerate, just like other arthritic joints, and they are involved in 12 to 25% of low back pain is coming from a problem in the SI joint. And it can lead to low back pain, referred pain in the buttock, hip, or leg. So treatments for SI joint pain may be as simple as over-the-counter pain medications, and this can include Advil, Aleve, Tylenol, or a pain doctor can actually prescribe higher doses of anti-inflammatories if necessary. For acute exacerbations, narcotic medications can be very helpful. Over the long term, though, the risks start to outweigh the benefits, so these are not a good idea. Physical therapy can be very helpful for strengthening up the muscles around the pelvic area and taking pressure off of the painful arthritic region. Chiropractic treatment can be helpful as well because there is some movement in that joint, so it can be manipulated. TENS units, which you can see here, is about the size of an iPod. It's run off battery power. It has leads that go to these foam pads that can be placed over the painful area. And small electrical impulses go through the skin, and they can alter the way the brain perceives pain signals and give pain relief. Also, ultrasound, electrical stimulation, massage, all these can provide benefit. Now we come to the interventional treatments. The first one is trigger point injections. These are small little needles that go through the skin around the back, and they can ease spasms and aching nicely. SI joint injection is basically just a steroid injection into the joint. Now, these joints are fairly jagged and irregular, so they shouldn't be done blindly. The pain doctor should be using some sort of image guidance, such as this, fluoroscopy, which is real-time x-ray. There's the joint there. Or ultrasound. Okay? And they can provide weeks to months of pain relief, and then the steroid injection can be repeated. A lateral branch block injection is not an injection into the joint. It's actually an injection off to the side of the joint where the small little nerve endings are actually coming in to supply sensation. And this can block the transmission of those nerve endings and provide pain relief for weeks to months as well. And if that works and then wears off, a radiofrequency ablation can provide over 6 months of pain relief. Here's an image of what the radiofrequency ablation, it's a cartoon. So the lateral branches are these tiny little nerve endings here, 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 and they are actually bringing sensation in to the SI joint. Okay? So radiofrequency ablation will sort of deaden those by using thermal energy and heat, and that can provide, this study from 2012 showed over half of patients achieved at least 6 months of considerable pain relief with an RF ablation. And then the procedure can be repeated when the pain relief wears off. These are outpatient procedures that are low risk, and it's increasing in popularity tremendously. So the bottom line is that SI joint pain is not really a surgical solution. It does very well with non-operative treatments. The top pain management clinics in Nevada are Nevada Pain Network. You have comprehensive pain management services in the greater Las Vegas area at numerous locations in Summerlin, Enterprise, Henderson, Las Vegas, accepting over 50 insurances and providing over 50 treatment options with board-certified pain doctors, chiropractors, acupuncture, spinal decompression therapy. They are highly skilled. They've won the Patient's Choice Award 5 years in a row for their bedside manner along with their skill level. The number to call for scheduling is 702-323-0553. And visit us on the web at NevadaPainNetwork.com. I'm Dr. David Greene with the Nevada Pain Network. Your pain stops here.